Focusing on health this afternoon, and the Health Ministry is yet to designate health facilities to treat Ebola in case of an outbreak. Head of Disease Surveillance at the Ghana Health Service, Dr. Akodi, outlined plans to establish 3 Ebola treatment centers in the country to be made public by end of the week.
The ministry and then the head of the service, the Director General, before even Ebola, has sent directory to all health managers, the national, regional, district and facilities to ensure strict adherence of infection prevention and control, which has clearly been spelled out in our guideline for infection prevention and control, well circulated and all facilities have access to this. I'm aware that our big hospitals, the teaching hospitals, the regional hospitals and the district hospitals at least have some place of isolation for infectious disease conditions.
At the moment, some of these facilities in hospitals in Accra are really under pressure with the increasing number of cholera cases. At the La General Hospital, for instance, there is a spillover of cholera patients to the outpatients department.
Within the next week or so, we've started the process, and by the end of the week, at least 3 designated facilities which shall be cover the southern zone, the middle zone, and the northern zone, and based at Accra Tema area, and then Kumasi and Tamale will be ready for us specifically to use for Ebola.
Over the weekend, there were unconfirmed reports of doctors running away from a suspected Ebola patient at the Nkomfanochi Teaching Hospital in Kumasi for fear of contracting the disease. Although it turned out not to be Ebola after the test, it confirmed fears of some health personnel who are yet to see protective equipment reported to have been deployed by the Health Ministry.
We've distributed more than 1,400 PPEs to the respective facilities that are likely to be the front line of seeing cases.
Dr. Akodi admits the number is limited and they will need to add up. About 24 suspected cases of Ebola have been reported in Ghana since the outbreak in the sub-region, but all the tests proved negative.
Health Minister Dr. Akodi says government is monitoring with keen interest the Ebola scourge within the sub-region and will not renege on the efforts to protect Ghanaians. The inter-ministerial team was briefing journalists in Accra yesterday.
Until now, a technical team made up of representatives from various state agencies was handling Ebola-related issues in the country. The interministerial team, comprising of the Ministries of Health, Interior, Defense, Communications and Local Government, is taking over to intensify the fight and supervise the existing technical team. This comes after the Immigration Service, the Ghana Medical Association and a cross-section of the public this week cast doubt on the country's preparedness to deal with an Ebola outbreak. Health Minister Dr. Akodi outlined what is being done to protect the public.
The disease surveillance system in the country has been placed on high alert through intensification of viral hemorrhagic fever surveillance. The field officers are on the alert to pick, package and transport specimens to the lab for confirmation. Port health officers have been given orientation in detection of cases at points of entry. We have activated a system for screening all passengers, especially those from countries that have recorded cases.
On funding, Ministry of Communications allayed fears there is adequate funding.
Do we have enough funding? I would say yes. WHO has provided some assistance, technical, logistics, and also cash. Government has also provided the needed assistance. We are scaling it up. That is the reason why the interministerial team has been put together to augment the efforts of the technical team.
Ebola is not airborne, the WHO country director added, calming growing fears of the public. In the meantime, the public is advised to reduce mass gatherings, wash hands with soap regularly, and be mindful of the early symptoms of the disease: fever, headaches, and intense body weakness.
And reports indicate some health officials at some health facilities are fleeing the slightest suspicion of Ebola case. These officials claim they are not properly protected in attending to suspected patients. We bring you a playback of an interview by my colleague Komla Kluche. He spoke to a nurse on that very issue, and that was done on anonymity.
You had an experience when a suspected person of Ebola was brought to your facility. Can you run by us what the experience was like?
Okay, so I was on duty that fateful day, and we had a patient who was vomiting blood, having bloody stool, bloody urine, and all that. But there was nothing protective, so we all were alert that there was Ebola around. And so the fear was that we were all going to be contaminated and then going to die in 6 days. And so the psychological change alone was so scary.
Looking at the readiness of the facility, have you physically seen like some centers that have been created to take care of patients like this?
No isolation unit, nothing of that sort. We are all in danger of getting it in any way, but no centers, no isolation, nothing.
Still on Ebola, meanwhile, a member of the technical committee on Ebola working with the interministerial committee, Dr. Bashiru Boykikimoto, says there's no need for panic as the country is ready to battle and deal with any possible case. He spoke on News at 10.
I'm a little bit saddened. I'm saddened because I don't know where the nurse is working, first. Secondly, I don't know whether she's a public health nurse or not.
She is a public health nurse.
Okay. If she's a public health nurse, one of the things I will advise her is that next time there is something like that, the best thing is move those people who are healthy from that particular room and put them somewhere. And then you now leave only that patient in that particular room. Then you now invite your bosses to come. That's how you have to handle it. You don't run away. Because by your training, you cannot run away and leave a patient.
Which of the facilities do we have?
Actually, what I will tell you is that so far the National Technical Coordinating Committee for the Emergency Preparedness Plan for Prevention of Ebola from entering Ghana has done a lot through the WHO. We had a lot of PPEs, that's personal protection equipment, which we used during the flu time, and some were left. So we added more from the WHO, and they were distributed about 1,440. That was
for the swine flu, right?
No, that
was for the swine.
There were some small left after the swine flu, but there was addition from WHO, and it was distributed to all regional health facilities for onward distribution to them.
But they were specifically for swine flu.
No. You know, one of the things you don't understand, these viral diseases, their mode of transmission are almost, like, preventing yourself from being contracted. If you wear these PPEs, masks, goggles, gloves, and then the suit, you are fully protected. So the one that was left before. But we told the WHO that they should bring in another type, because we realized that in Sierra Leone they used one that was not very, very distinct. So they have actually brought in some. Today they said they have brought in some more.
And Deputy Director of Disease Control, Dr. Shea Farid, says airport officials will set up a machine that will indicate the temperature of passengers, all in a bid to look out for any case of Ebola. Fever is one key symptom of Ebola, but when passengers are asked if they have fever, they deny, which according to health officials is not helping the control of Ebola.
there's a screening form that has key symptoms that is used to screen those who are coming, but practically to make sure that we target those coming from the West African sub-region. We have suggested to the board, and the board has accepted, that they will install a temperature detector at the port head point. And it is such that it's like a TV screen. If your temperature is above normal, your temperature is registered on the screen, and it follows you as long as you are within the vicinity till you leave. So once you have fever, we will definitely pick that, and once it is picked, then the other symptoms will be looked for. It's a little expensive, and this cannot be installed on all the entry points. For the entry points, including the flower that was mentioned, we have 14 designated entry points out of the 45 points, some of which are not regulated points. For those designated points, we have port health staff trained with screening tools that are used to screen those who are coming. And they also make observations.
So it's still about health. We're still focusing on Ebola this afternoon, and the Coalition of NGOs on Health has expressed concern about the preparedness of the country's health facilities to deal with an outbreak of Ebola in the country. The coalition is advising government to explore all available means to ensure not even a single case is recorded in the country. This afternoon in the studio over here, I do have Cecilia Senu, the chairperson of Coalition of NGOs on Health. Good afternoon.
Good afternoon.
And thanks for your time.
Thank you.
Now, what do you make about the Ebola situation as it stands?
We are looking at the rising figures. I mean, every day you wake up, you don't know what is going to happen in Ghana. It is worrying, and civil society is very worried. I am the vice chairperson of the coalition, not the chairperson. And civil society is also concerned. I know the government is really putting a lot of things in place, but I think we need to do more, have more resources, and even fund available, and let all the citizens, everybody should know what is happening at all levels. Hospitals, nurses, the health workers, some of them are still concerned, especially looking at the protective clothing, things that you have to do. And as a country, are we ready? That is the question that civil society continue asking.
Now, WHO calls this outbreak unprecedented. As at now, that's yesterday, July 31st, 2014. The figures from WHO was 1,332 cases, and then the death had also moved up to 729.
Yeah.
This is a disturbing issue, and then, like you did mention, we're hearing of government doing this, government doing that, government doing that. Have we delayed coming up with a preparedness plan?
Every country has to be prepared, because we know there are emergencies.
Have we delayed first?
We have delayed. We have delayed because the moment you hear it, the disease in the sub-region, you don't even need to wait for it when you start suspecting cases in Ghana. We believe that immediately we hear it somewhere in Sierra Leone or Guinea, the first case, Ghana should be prepared. I believe that people even on the ground, though communities are hearing it, are they well prepared so that when they have any suspected case, they will know that this is a case. So we have delayed. Health promotion, we have health promotion unit of the Ghana Health Service. They should be on the ground now. Everybody should move. All stakeholders should move, and we start getting ourselves. Even we should have done that. We are late, but still it's not late.
Now, the WHO again did indicate that all cannot be left to government alone to do. Now, as an association, NGOs on Health, a coalition of NGOs on Health, aside being here in the studio, what critical role are you also playing to ensure that enough education has gone out, probably through assistance, funds? You might not be able to do it alone. Private sector should also come in. But if I'm focusing on the coalition of NGOs on Health, specifically, what are you doing to support government?
It's rather unfortunate that government doesn't see the contribution of civil society. Currently,
I didn't say that government.
No, I am saying that they see. Ministry of Health, Ghana Health Service, we are pushing. They are now recognizing. Civil society. Currently, I moved from La right now. I just drove from La. When we heard of the cholera outbreak, we didn't wait for anybody to give us money. We just moved to the ground. Civil society is on the ground now, giving education, doing house to house, teaching people how to do hand washing. There are some of them who are already working there. Hope for Future Generation, which is my organization, we work in La. And so we are on the ground with support from global communities, USAID. We don't wait for money. We are with the people. We can mobilize because that is our mandate. We are giving information to the community. We are doing house to house, talking to families how to do. The Ebola, the moment we heard it, we integrate it into our existing programs.
So how many people have you been able to reach on Ebola specifically?
Currently with our program, we have reached out to 2,500 people now.
Where?
La, Nima, the areas that we work. In the regions that we work, our members are also there. Now we are getting information materials because it has to go with some IEC materials. We have spoken to Health Promotion Unit of Ghana Health Service. They are giving us information. They send us WhatsApp, different information. So we are on the ground directly giving it to info. We are working with Ghana Health, the DHMTs at the district level, but we still need more. You see, because we can't wait. A lot of people, we realize that people in the village don't even know what it is. They are not yet, the message is in Accra, in the big cities, but on the ground, it's still limited. And that is what we are trying to do.
Okay, well, thank you very much indeed. I have been speaking with Cecilia Seno. She is a vice chairperson of the Coalition of NGOs on Health, and they're raising some concerns on Ghana's preparedness on Ebola. But aside that, as civil society, she says that they're also contributing through education to let people know what really Ebola is and how they can also prevent it.